Bismillahirrahmanirrahim. Right, ladies and gentlemen, today we are going to focus on morphology of lung carcinomas. It's different types, the major ones actually, not all the types of lung carcinomas. Now, you should remember at least these four with respect to morphology. These are the four major histologic subtypes of lung cancers: adenocarcinoma, squamous cell carcinoma, small cell, and then large cell carcinoma. There are other types. A table is given in your books. There are mixed types like adenosquamous carcinoma, but these are the four major categories you should remember. Now, moving on to the first one, adenocarcinomas. Now, these tumors have different differences with respect to location, general differences with respect to location, and some epidemiological differences. First thing about adenocarcinoma is that they are usually peripherally located in the lung, near the pleura, for example, in the apex, for example. They generally grow slowly and they widely metastasize at early stage. The most common growth pattern of this variety of lung cancer is the acinar, that is the gland forming. Then there are other types like papillary, solid, and mucinous as well. Okay, this is the most common. This is the most important for your exams. Now, moving on to squamous cell carcinomas, they are more common, remember, according to books, in men and smokers, but they can occur in females as well. And they are mostly centrally located in the major bronchi. They can spread to contiguous lungs, but they are mostly centrally located. Then the large lesions can show necrosis as well. As they grow large, any tumor can get necrotic. The squamous cell carcinomas have a variety of morphological appearances. The most well-differentiated one shows polygonal cells with eosinophilic cytoplasm, prominent nuclei, and keratin pearls. The poorly differentiated ones may not show all of these classical squamous cell features or squamous cell carcinoma features. The range, but at least remember there are nests of cells, there are groups of cells, they have prominent eosinophilic cytoplasm, prominent nuclei, and keratin pearl formation. Remember this word, keratin pearl formation, and intercellular bridges as well with respect to squamous cell cancers. Now, as I said, there are some differences with respect to location among these cancers. Adenocarcinoma was more peripherally located. These are also more centrally located. Small cell, when we talk about small cell cancers, we saw adeno more peripherally, squamous cell more centrally, and then small cell carcinomas more centrally located as well, and then can extend into surrounding lung parenchyma. Important thing to remember is that they are associated with certain paraneoplastic syndromes. They can give you in a scenario different manifestations that vary according to the location, according to the histologic type actually. Okay. Now, small cell carcinomas, as the name indicates, they're generally smaller. They're small tumor cells, but they can be a bit large. They can be round to oval in shape, but they generally have a scant cytoplasm. And one thing very important with respect to scenarios in your real life is that in the reports you may find that they have a salt and pepper chromatin. Okay, granular chromatin that looks like salt, that's likened to salt and pepper appearance. So, and then there are many mitotic figures. Usually it's a high-grade tumor, then there are areas of necrosis, then areas of crush artifacts, and nuclear molding as well. Large cell carcinomas, the most important thing you should remember is that they show no evidence of glandular or squamous differentiation, and then they also lack typical cytological features of small cell carcinomas. Okay, so and then the cells are large, have prominent nuclei, other features of cancer. Now, the first tumor we talked about was adenocarcinoma. Then we talked about squamous cell carcinoma, just to recap, then small cell, and then large cell carcinoma. Now we move on to the morphology. Now, if you look at this slide, this photomicrograph, you can see here there's a structure being formed. This is a glandular structure being formed. You can see here glands are being formed. So we saw the glands are found in the cancer known as adenocarcinoma, and then there are cytological features of malignancy. There's invasion into the surrounding areas. The individual cells show high NC ratio. There's hyperchromasia, the typical features. But the first thing you notice on this slide is the glandular formation and then other features of cytological adapia. This photomicrograph, this inset shows an immunohistochemical marker which has been applied to confirm the presence of an adenocarcinoma in the lung. Now, this is a tumor which most likely I think its point of origin probably most likely was this area, and it has spread into these surrounding areas. Now, we talked about a tumor that arises more centrally, in more cases centrally, and then moves in the surrounding areas. So this is an example of squamous cell carcinoma that has invaded into the surrounding lung parenchyma. You can see this is the fairly normal lung, and these are the areas showing tumor. Now this is a photomicrograph that is showing invading nests of cells. You can see of variable shapes. There's no distinct gland formation. There is no distinct gland formation here. You can see there's a nest of cell that is invading into surrounding areas, like all of these. And then there's a particular the cells cytoplasm is a bit more eosinophilic. You may not be able to appreciate it on this magnification, but if you look closely in this region, the cytoplasm is eosinophilic, okay? And then there's a structure that is known as keratin pearls. You can see here, this is a keratin pearl, one example of keratin pearl, then there is another example here. This is how it looks like, some spindly intertwined kind of material with visible nuclei in some areas and not visible in the others. So these are the keratin pearls. You should remember the structures with respect to squamous cell carcinoma, okay? In addition to cellular morphology, of course. Now, this is a tumor that is showing an area of necrosis as well. You can see here, this is an area of necrosis where the cellular outline, there's just vague outlines of cells. The nuclei are gone. The cells have turned into an area of necrosis, and here you can see the tumor. Now the cells vary in shape. We saw a tumor in the text. Here you can see there's a bit round cell. In this area you can see there's a bit round shaped cell in the center here. Okay, and then there are spindly and fusiform kind of cells like here, but this tumor appears more blue in comparison to the previous ones, and these have a scant cytoplasm. Cytoplasm is not really appreciable much in comparison to the previous tumors. So this is a small cell cancer we talked about. There may be areas of necrosis like this one, these high-grade nuclei, then there might be mitoses as well. So here's one particular example. So this is it for now. Please let me know if you have any questions. Thanks a lot.